It's good. Let's get out crunch several hills book yourself. That's covered. There, you enter for me a little I. That's it. So if you guys have any questions about that, you can call or text 727. Cool. Just and you're back to more pounds than where you were at from the start, guys, because you didn't change concentration after that. So I did a lot of inquiries about growth hormone. Right? Dr. Pepper, the patient is really expensive. Real growth hormone prescribed by a doctor, medical in a U.S. licensed pharmacy. And at that point, you're paying like $1,500 per like that. Young, you can see, as far as, in doctor's land, because doctors,
in medicine, things evolve and change over time. So it's best to have the latest and greatest when it comes to medicine and medical therapies.
Awesome. So tell us a little bit about yourself.
So hi, everyone. Thanks for having me. Thanks for inviting me, John. I'm Dr. Patrick Byrne. I grew up here in Tampa, and I went to medical school at LECOM in Bradenton here in Florida. And for training, I trained up at Hormone University Hospital in Philadelphia, Center City, in the Drexel Family Medicine program up there.
Yeah.
So very glad to be back down here in Florida.
Absolutely.
Yeah.
We're glad to have you guys.
Hanging out at water under the sun.
Very cool. Yeah. Very cool.
Very much welcomed. So, talking about some of our therapies, especially for stimulating growth hormone, you're right. Yeah, we don't do straight growth hormone here. Number one, it's very expensive, and there's potential for abuse, etc. There are some side effects, but so our therapies include growth hormone secretagogues. So basically, that is stimulating the body's own natural production of growth hormone. Okay. We can talk about sermorelin Forte Plus, CJC, ipamorelin. We also do have straight IGF here as well, if the lab work is clinically appropriate for that.
Right.
Yeah.
Even the MK677, I know that's the only oral version of an oral GHRH, growth hormone releasing hormones that he's talking about.
Right, exactly. The MK is a nice option especially for the needle phobes out there, folks who don't like needles.
There are people out there.
It's very common. Yeah. So this is an oral option that you take. Will stimulate the appetite a little bit, so you need to take that into consideration as well. But that may be appropriate for some of you folks who are looking to bulk up and increase mass.
Right.
Okay.
Some people can't eat, and some people do come to us. They say, "Listen, I just don't have an appetite. I can't keep on weight. I'm slimming down no matter what I do. I'm just eating everything that's in front of me, and it's still doing that." So it is really, really good with that. There are some really, really good studies out there on MK677. We know that CJC and Imprelin are a better new, cutting edge therapy. Taking out sermorelin, the old GHRP 2 and 6.
Yeah.
That a lot of people do use still.
Yeah. Sermorelin can be very, efficacious for some folks. And we do see a varied response to that. So some people respond a little bit more to the sermorelin than others. Now, we couple the sermorelin with the growth hormone releasing peptides 2 and 6. So kind of attacks it from different angles. You get a little bit of a synergistic effect there. They act on different receptors to cause, to help stimulate maximum growth hormone secretion in the brain. Some people can form antibodies to sermorelin over time, so it's possible that it may become less efficacious over time. So that's another reason why CJC ipamorelin is sort of outperforms sermorelin as far as a growth hormone secretagogue peptide that we offer.
That's really cool.
Yeah. The other thing with CJC and ipamorelin, the reason I prefer it over the traditional sermorelin is because it won't cause the increase of other hormones from the pituitary, such as cortisol, aldosterone, prolactin. These are things we don't necessarily want to stimulate.
Right.
We kind of just want to focus on the growth hormone to get the downstream effect, increasing the IGF-1 levels, production levels in the liver.
Right.
Yeah.
That's cool.
Yeah, and the CJC ipamorelin, when used together, also have synergistic effects, meaning that it's going to have a greater effect than just each individual therapy on their own. So we like to couple that together.
Absolutely. Yeah. So they're working synergistically together to give you the best results.
Absolutely, to increase that, again, your body's own natural production of growth hormone.
Yeah. Guys, we're here for results. So I mean, this is great knowledge that Dr. Byrne is dropping on you guys. So I hope you guys are taking it in. And we get it all a lot, and I've been seeing a lot of ads. So growth hormone sprays, growth hormone gels. Guys, there's no such thing. I mean, it is like smoke and mirrors. And it's great marketing, I guess.
Sure.
Because everybody knows those words, so everybody's trying to go after it. But no, it's just what it is. And with growth hormone, we talk about IGF-1.
Right.
I love IGF-1 if the labs are good, family history, and there's certain things.
Absolutely.
But if everything's perfect,
right.
IGF-1R3 is a really, really good option for a lot of patients. We've got some good results from a lot of patients with it. But MK677 or the CJC and Perelin, it's just, whoever the patient is, it might be different. It's not a cookie cutter thing, and one option might be better than the other.
Each individual is different, but at the end of the day, what we're trying to stimulate is increased production of IGF-1 in the liver. Okay, and for those of you who aren't super familiar with IGF-1, it has a lot of regenerative features. It has some anti-aging properties to it. It's going to cause protein synthesis in the muscles to help you build muscles. It's going to promote lipolysis and inhibit lipogenesis, which is the opposite of what insulin does. So basically, it's going to break down fat to be used for energy as opposed to storing fat, which is what insulin does.
Gotcha.
Okay, so for the fat burning effect, the weight loss effect, it is an appropriate therapy for that as well.
Nice.
Yeah.
Nice.
It increases bone mass density, supports joint health, strong fibrous tissues, and like I said, it does have anti-aging properties. And the reason it does is because it inhibits cellular senescence, which it blocks, or not blocks, but decreases apoptosis or inhibits it, which is a fancy word for programmed cell death, basically. So all your cells are programmed to expire at some point, and IGF inhibits that.
Gotcha.
Yeah.
Gotcha. Right. That's awesome.
Yeah.
All right, well, I learn something new every day, and I know a lot about IGF-1 and stuff like that, but to hear Dr. Byrne speak about it definitely teaches me a little bit more. And you hear all the benefits about these things, so the benefits are there. And obviously, with anything, abuse, you don't want to abuse things.
Sure.
That's why you want a medical professional. You want to know where you're getting your medications from, right? Yeah. And having somebody monitor you and monitoring your blood levels and symptoms. Maybe there's a problem. Maybe you're getting edema in the legs, or something else is going on.
Right.
That you need to talk to a medical professional about, and maybe get some advice and what to do or recommendation.
And that's why we call all our patients every month, check in on them, just making sure they're feeling good, not having any adverse effects, etc.
That's right. Or they can call us right away. I mean, if they're having something right away, text.
Yeah.
But we do check on them every month. I mean, and that's the case.
Now, is IGF appropriate for every single person out there? No, it's not, because it is such a powerful cell stimulator, and it increases cell growth. It also is going to increase the growth of any tumors, mass, cancer, etc. If you have that going on. So if you're someone with a history of any of that, we would not think IGF is appropriate.
Right.
Yeah.
Absolutely. Absolutely. Because health is #1 priority here, guys. It always has been. It's not about getting jacked up or being the biggest. It's about quality of life and living at your best. Feeling the best, looking your best, and your body's healthy in the inside and out.
Absolutely.
It always shines through like that. I've seen guys or girls that look like Ferraris on the outside and Pinto engines on the inside. And some of these, literally, some of these people have to get kidney transplants. They have severe liver damage. A lot of different things, so you really got to take care of your body, and it's your temple, so make sure you guys are checking. So guys, for blood testing, we do nationwide blood testing, and all these different blood tests that your normal general practitioner will not run on you guys, or doesn't usually. Even if you bring it up, it's still an issue sometimes. I don't blame them. General practitioners have to turn and burn. That means they have to see a lot of patients so they can get ample amount of money just to open or keep their practice open. So I don't blame them at all. Or they might not be in tune and they don't want to open a can of worms they haven't been into, which is totally fine. So these blood tests, there's discounts coming up. Black Wednesday is upon us. We are in November. I can't believe it.
Time flies when you're having fun.
I'm telling you, man. End of year's here. The franchise is going well too, so you guys are going to be seeing a lot more Titan. I promise you on that. We're also going to do the giveaway, guys. So the $100 gift certificate, we'll do it. Hashtag Titan Gift. Text it to 727-389-3220. Okay, Titan Gift. Hashtag. Text it to 727-389-3220. For the gear, the Titan gear, leggings, shirts, all that stuff, for the website, you'll have your hands on exclusive Titan gear that nobody else has. Hashtag Titan Gear. Text it, 727-389-3220. Hashtag Titan Gear. All right, guys. So you guys have heard about some of these different therapies that we offer. You've heard Dr. Patrick talk about some of his insight on some of these things, and a really good breakdown of how these things will help you. Is there any therapy you think that you recommend, like off the bat, that you've seen or heard that might be, I don't know, worthwhile for somebody to check into?
I mean, for me, I think the Complete is an overall wellness therapy.
Okay.
That's can be pretty applicable for just about anybody out there.
Okay.
Who has fitness goals in mind.
Okay.
In terms of either building lean muscle mass or decreasing fat composition in the body, or just wanting to kind of promote the immune system with all the B complex vitamins that are in Complete, which does help with red blood cell production, skin, hair, and nail health, properly metabolizing your fats and your carbs, etc.
Yeah.
So yeah, the Titan Complete I would recommend to just about everyone out there. The fat burning component in Titan Complete is the MIC, the methionine, and acetylcholine, and L-carnitine.
It's huge, guys.
And those are amino acids, and it basically just stimulates to take fat from the body's fat stores and mobilize it to be used as a fuel for energy.
Absolutely.
Yeah.
Here's another information for you guys. So when you guys see those cool injections, super MIC injections, all that is MIC with B12 in it. With Titan Complete, you're getting B complex in there, you're getting the MIC, you're getting all 3 branched chain amino acids, L-carnitine. You're getting this all in one injection, guys. We'll talk about that injection more next week. Make sure you guys are talking to a medical professional if they're looking over labs, or they're making recommendations about medications, or they're prescribing you medications.
Yeah.
It's scary. It's scary.
Can be, yes. You want to use caution out there. But now you touched on a point. It is an injectable therapy, and that's important. We don't want to overlook that, because the bioavailability of these amino acids is going to be so much greater in an intramuscular injection delivery method, as opposed to when you take it orally by mouth. A lot of that gets degraded in the GI system. Your stomach acid breaks it down. So you don't absorb as much when you take it orally.
Yeah,
so that's the one thing I would caution folks out there when they're at the retail stores and they're buying an oral supplement. Just remember that bioavailability is going to be much less.
Right, and that's even if you're getting 100% of what's in the capsules as on the label, because we know that it's not regulated to that point. So unless it's inspected and it's regulated by somebody, you really don't know. With us, you do.
Comes from a pharmacy. All the batches are tested for sterility and potency.
Yep.
Endotoxins.
Yeah. The whole nine. So if you guys got any more questions about these therapies, guys, give us a call, 727-389-3220. Please do me a favor. Hit our social medias, Instagram, @Titan Medical, obviously Facebook, hit us up on there, Titan Medical Center, and YouTube. Go subscribe, guys. All the educational videos, the injection videos, us talking about really, really cool stuff. You guys are going to see it all. Check it out. Titan Medical Center, YouTube. All right, guys. I'm John from Titan.